have to put those pertinent negatives in there if you had a patient that had a chest injury.
What page is that?
It's on 1039, left-hand side of the page, second paragraph, pertinent negatives. Got it?
Yes, ma'am.
All right. Chapter 30, page 1057. Know your anatomy of your abdominal section. Top of the page, it contains organs that make up the digestive, the urinary, and the genitourinary. Those are the only systems that are abdominal and genitourinary. What's the limbic system? Anybody know? Is that part of our abdominal genitourinary system?
No.
Limbic system, good, very good. The limbic system is not. So there's only 3 systems that make up this area. I would know them, and I would know what they are, how they're described. 1058. Mesentery. I would know what a mesentery is. That is right-hand side of the page, second paragraph. The mesentery refers to any fold of tissue that attaches an organ to the body wall. I would probably know what a mesentery was.
Where's that one at?
Right-hand side of the page, 1058, second paragraph, about 2-3 sentences down. It's in italicized. The term mesentery refers to any fold of tissue that attaches an organ to the body wall.
Okay, thank you.
Cool. And if you keep reading, it says the intestinal mesentery. So it's like a big sheet of tissue that holds all your intestines in place. Otherwise, when you do a headstand, you don't want your intestines to go flying up into your chest cavity, right? So it has to be attached somehow, and it's attached with a mesentery. 1074.
What page did you say?
1074.
Thank you.
Right-hand side of the page, external female genitalia, second paragraph. When we're talking about trauma to that area, it's always important to determine the possibility of pregnancy. That goes with any really kind of call. Doesn't have to be trauma. It could be somebody complaining of belly pain. It's medical. But if they're female and they're within those years, childbearing years, you must always ask if there's a possibility they could be pregnant. Um, 1060. What Donald is going to go? Make sure you know how a properly seated seatbelt lies. Right-hand side of the page, increase from seatbelts. Couple sentences down. When worn properly, know where it lies. It should lie below the anterior superior iliac spines of the pelvis and against the hip joints. When it's worn properly. Hmm. 1071. Evisceration, know how to treat it. It's right there in those pictures. You can just, it's illustrated at the down on the page. Know how to treat an evisceration. 1058. Peritonitis, signs and symptoms of peritonitis. Left-hand side of the page, pretty much around the last sentence. A condition known as peritonitis, the intestines and stomach contain acid-like substances. When these substances fail or leak into the peritoneal cavity, they cause pain and irritate the peritoneum. So, what are some of the signs? The first signs is number one, and usually is the worst, is the abdominal pain. 2 is tenderness, and 3 is muscular spasm. And then get nauseous and probably vomit. (1062). Left-hand side of the page, signs and symptoms of an open injury. A couple sentences, maybe halfway through that paragraph. A very common early sign of a significant abdominal injury is tachycardia, because the heart is increasing its pumping action to compensate for the blood loss. That's the beginning of our shock.
Which page is that?
1062.
Okay.
Left-hand side, under signs and symptoms of an open injury. Halfway through the paragraph, it says a very common early sign of abdominal injury. It's tachycardia. Why? Because the heart needs to pump blood faster for the blood loss. And what do we call that? We call that compensated shock, right? We already know about compensated shock. 1073. Sorry if I'm going fast. We only have like 20 minutes.
Okay.
All right. 1073. Urinary bladder injury. Right-hand side of the page. Couple sentences down. Urine sometimes spills into the tissues. And any urine that passes through the urethra is probably going to be bloody. Blunt injuries of the lower abdomen or pelvis often cause this rupture. I know all about that. 1064. Oh, you guys already know this. What is the biggest organ in our body
Skin?
other than the skin?
Oh.
Liver. Very good. Know its function. I would know its function. All right. 31. (1132).
What page number?
1132.
32. Compartment syndrome. I would know all about compartment syndrome. Usually commonly occurs with a fractured tibia. Right-hand side of the page. It typically develops within what? 6 to 12 hours, and usually as a result of excessive bleeding. A severely crushed injury or the rapid return of blood to an ischemic limb. Remember, we kind of talked about that once. I told you guys that we have an actual protocol for that, and we have to, start an IV and give you fluid, or we usually give you bicarb, all this stuff before we actually let your limb free. Know all about compartment syndrome. 1117. What do we do with fractures? What's one of the most important things we do before we splint?
PMS?
PMS. Know your PMS. Know that you better do that before, usually sometimes during and even after. But only before and after you splint. 1110. The figure at the bottom on the right-hand side. All right, we're talking about how to apply traction. And basically, the sentence that they're talking about above the picture, however, if the patient strongly resists the traction, or if it causes more pain, what do you need to do? You need to stop and splint it in the position that you find it. Okay, to 1125. Oh, know all your hemo terms. You got hematuria, hematemesis, melena. Know all the bleeding terms. And you can see hematuria on the right-hand side of the page of that page. All right. 1096. Oh, wait. Sorry. Yeah, 1096. Holy shit, that was good. No, that can't be it. I'm sorry, that can't be it. Should be probably 1196. Let me see. Basically, know your signs and symptoms of a dislocated joint. I'm trying to find it actually for you.
1096 on the bottom right, it's bulletin points.
Oh, 10 what?
90.
Oh, on 1096. That was my problem. I was at 1196. Okay, yeah. So know your signs and symptoms of the dislocated joints. 1115. Hazards of improper splinting. Know those bullets. 1087. Muscles. Know the different types of muscles and which ones are do what. Well, if you start reading, it talks, there's 3 types. There's skeletal, smooth, and cardiac. You guys should already know this from anatomy. So know which one's under direct voluntary control and which ones are which ones are involuntary. 1128. Knee fractures. Let's see. Fractures about the knee, bottom of the page, right-hand side. Because of local tenderness and swelling, it is easy to confuse a non-displaced or minimally displaced fracture about the knee. You could confuse that with a ligament injury. But do we really care as EMTs? No. We splint it the way we splint it and we transport. But they're just saying that sometimes we, we confuse those. All right. 32. Level 61. Left-hand side of the page, we're talking about the organs that are usually most severely affected by the air embolisms. It's underneath the bullets. And it's the brain and the spinal cord are the organs that are most severely affected by air embolisms because they require a constant supply of oxygen, which is a common sense thing. We know that those are the most vulnerable that don't like not having oxygen. Okay, 1153. Know what a diuretic is. Right-hand side of the page, very top of the page, first paragraph. Know what a diuretic is. We probably already know. We all know what a diuretic is. But what you need to know is patients with an inadequate oral intake. So if they're not drinking enough and they actually are taking diuretics, they're going to have a lot of difficulty tolerating exposure to the heat. Why? Because they don't have any stuff